and 54% sensitivity, and 85 and 99% specificity. Thank you very much.
Thank you, Ms. Datsun, for that update on the status of RDT test kits and the work that the FDA has been doing to answer the question whether or not we have any that we can use here in Ghana. I want to invite Dr. Patrick Aboagye on the Ghana Health Service brief, the status of our active cases, and the case management report that follows from there. Welcome, Doc.
Thank you very much, and good morning. Honorable Minister, media colleagues, as the Minister said, we'll be brief. After 23 hours, 26th of July, we had the number of Ghana's active cases stood at 3,617 cases. Recoveries out of the total that has been included 30,621, with a cumulative total of 34,406 cases. I'm just giving a summary. The death rate is about 168 of them have died, and we have 0.54% case fatality. That is the proportion that dies 0.454%. We have so far conducted 382,752 tests, bringing our tests per million population to about 11,792, which is relatively quite high by all standards. Based on this, we have a test positivity average total of 8.99%, 8.577 from contact tracing, and 9.71 from routine surveillance, which is to be expected. I just want to talk about the positivity rate, is that it depends on the testing strategy. We are now moving more to, because we've done a lot of the risk assessment, we've done the sweeping, and so we are doing more targeted testing, which means that people who are showing symptoms and their contacts and high risk groups. So you expect that because you are targeting specific group, your positivity will be higher than when we started with the 2%, etc., because we're doing a larger group. The next slide shows our performance in terms of the number of cases on the day the samples were taken. You can see in the last few days, we continue to show a gradual decline. And the graph on your right is the moving average, which tries to bring us as close to the reality as possible in terms of the number of samples per day, positive per day. And that also has shown a decline, a continuous decline, that we're hoping that it will continue as we all continue to increase our adherence to the protocols and social distancing and other things that we are all doing. We are reporting a total of 782 positives this morning. And these samples ranges from 23rd of June all the way to the 25th of July, 2020. What it means is that as far as today is concerned, the most relevant positives are those who were taken about 2 weeks ago. And so a significant number of these people may have already recovered. Of the confirmed cases, they came from, the 782 came from 58 districts and 7 regions of the country, which means that 9 regions did not report any positives. Greater Accra contributed 428 new cases from 23 districts out of the 29 in Greater Accra. Majority were Ayawaso West, Accra Metro, and Korle Klottey. Let me explain Ayawaso West. Ayawaso West is reporting labs that works there, and so they continue. So most of them may not be residing in Ayawaso West, but the districts know where they are, and as we repopulate in our response, they are sent to the appropriate districts where those people who came for the test actually come from. Ashanti recorded 319 new cases from 21 districts, Kumasi Metro and Central South. Bono East had 21 new cases. Majority were them from Sene West, Kintampo, and Techiman, and the Western region has 7 new cases from 3 districts, from Wasa Amenfi West, where the team visited last week. Bono reported 5 new cases from 3 districts, OT, 1 case from KJB, Northern region had 1 from Tamale. The remaining 9 regions, as I said earlier, had no cases. And these are Eastern, Central, Volta, Western, North, Northern Ridge, Western North, Upper West, Upper East, Northeast Bono, and Savannah, and Ahafo. Now, so this is the breakdown of our active cases. As we said, we have had about 34,000 cases total. 30,621 have recovered, accounting for about 89% recovery. And so that brings out the total of 3,617 active cases. As we keep saying, active cases are the most important figure we need to focus on. These are the people we can say today they are carrying the virus. And like I said, if you compare this with malaria, we record about 800,000 cases of malaria every month. But I think we focus on who has malaria today. And that is the same analogy that we're trying to draw. The majority of the active cases are in Accra, which account for 2,459. Ashanti region has significantly reduced active cases to about 480 now. Western with 222, Volta region 111, and so forth. And then we have Eastern dropping to 49, Central 91, and we have Western North with 5 cases. Currently, Upper East, Northeast have no active cases. Savannah has only 1 active case, and then Upper West has 5 active cases. And as is shown on the map there, you can see the active cases there. If you look at the relationship between the deaths and the time of when we're having our peak, you can see that in June, when we had an increase, we also saw that the number of deaths had also gone up. And as the numbers come down, the number of deaths also has significantly reduced. As you can see to the right of your slide, you can see that in the week of 27th week, 28th week, 29th week, the numbers are significantly down, whilst we had the peak in the peak. If you look at the sharp graph I showed earlier, you see where we peaked, where we had a lot of numbers going up, that's when you also had the significant number of deaths. And so the more we apply the protocols, the more we adapt to the protocols, and then as we reduce the number of positivities, the number of deaths will also significantly come down. This is just showing you the date of death and the day they occurred, and you can see, it just shows just like the previous slide where the numbers are actually high, where we are having about 7 deaths a day as the highest we ever recorded. Now let's do some further analysis of our active cases. I think we've shown this graph again, and we continue updating the graph to see where the trajectory is. You can see that the total cumulative case, as usual, will go up. The recoveries are significantly up, accounting for almost 89% of all the cases, and you can see that the active cases continues to stay quite low. Of course, it changes. Tomorrow, depending on the number of people who are recovering, we may have a much lower active case today, and that's what we should really focus on. And now we are doing about 11% of all our cases that are active. The rest are all, I would say, have recovered. And that shows, in the graph, that shows, continue to show a downward trend, been high in the early parts of the distance, and then way back in the middle of June, we saw the decline and the continued decline that continued to show we're having that. So we need to focus on active cases, because that's where we need to respond with our healthcare services, our beds, our contact tracing, etc. This is where the main activities are as a nation. That's what we need to continue focus on. We're lucky that number seems to be going down or even staying low as far as even though the numbers cumulatively will go up as expected. The figures have not changed much. It's still that a significant number of people are males, and they range between the ages of 15 and about 50. And that is where movement is high. These are the active group, and that's where we're also showing a significant number of our active cases are in this age bracket. And so our messaging and our activities also are targeting this group to ensure that they become more careful. We have a relatively low incidence in children and the aged, but of course, even the aged, we have more in the male. So our messaging, the media, etc. messaging, and the caution must also go to not only to everybody, but more specifically to this group of people who stand at higher risk of contracting the virus and, of course, spreading it. Of the active cases, the current analysis we've done has shown that about 69% are asymptomatic, while 31% have symptoms. And of those who have symptoms, we are admitting about 94% of them. And even of those with symptoms, there are about 6% who are very, very fine, and so they are able to manage at home. So this is so you can see that the challenge, the graph to your right, is actually the focus where we really have to work on and ensure that we are managed appropriately. What are the symptoms? I think just to remind people, because this is a stage that we want to be with high index of suspicion so that you are able to report and get yourself assessed. Cough still remains the most common symptom that people will present with, followed by headaches, which is another symptom that people present with. So cough, headache, and then fever is the third, and followed by general weakness. And I think so these are some of the core symptoms one has to look for. And then we have chills and sweats is one of them. And then to some extent, some people will have difficulty in breathing, chest pains, loss of taste. Some may present with diarrhea, but very few. We also have some altered consciousness, and then now we have some that also have loss of smell. Remember, loss of taste is relatively higher than the loss of smell. And then we have a small group that will also present, in addition, with sore throats, a runny nose, and very, very few people may also present with abdominal pains. And so these are the symptoms that one has to look out for. And these are the things that one has to look out and see. If you start seeing these things, you should check and see how you're feeling. Of course, some of these things may also mimic the same way that malaria or other diseases can present. But these are all areas that one has to look out for and make sure that they are protected and they get diagnosed early and be isolated and prevent the spread and avoid any complications from COVID. Thank you very much.
Thank you. Dr. Patrick Aboagye. I would ask my colleagues to set up the microphones and we'll take your questions as quickly as we can. Let me just also provide some clarification. After the President's 14th update to the country, there have been lots of questions seeking clarification on what the current position is when it comes to easing of restrictions on churches, mosques, and other religious gatherings. Just to be clear, you will recall that initially only up to 100 persons could gather for a religious celebration, and that gathering had to last for not more than 1 hour, but you could have multiple services, and you still had to wear the mask and observe all the other preventive etiquette. In the 14th update, His Excellency the President, based on what has been observed so far after the initial easing of some of the restrictions, has stepped that up a bit to the effect that currently religious services can take place for up to 2 hours. Social distancing is the key, in addition to the wearing of masks and the observation of hand hygiene. And while observing social distancing, the maximum number is no longer capped at 100, but is determined by the size of your auditorium based on social distancing. In this auditorium, for example, we have seating for about 90 persons here in this auditorium. If we are observing social distancing, we are able to seat about 50. So if this was an example, we'll say while on an ordinary basis, you can accommodate about 90 persons here. Now, while observing social distancing, you can accommodate about 50. The same applies. And there are auditoriums that can take 1,000, 2,000, etc. Now the rule is social distancing, and then it allows you to determine your maximum number. Colleagues, if there are questions, please rise to the microphone at this point in time. One, two, three, four. And then we'll come for a final batch of 4 as we wrap up.
Good morning, Honorable.
Morning, sir.
Ebacho Midinde Akokraba Kasapa FM. Ekamia say yare coronavirus ebaye. Adeba kwaya na yebo honde urodi bia ese ebehe social distancing said ya okan ye no. Na ende omampanyi transport awodo on betimi afa full capacity. Mibisa se be de ni betimi ensure se social distancing we no betimi akoso ewo enkankan trotro ne mpono public transport emo. Afi nso no me semise tosmienu no eye nansen na eye omampanyi de ba numku eye 5-member committee eba ye no betimi ahwe ma wo mo asebio wo mo ewo suku ye nuanom no betimi ahwe na security ni protocols ntimi aye adwuma ho no ho akohia se ye benya obi nso so betimi ahwe se de be ya omotimi ai council wo mo se wo mo adwen mo ni ade enkan komo ko chiro exams ni awodo mi bisa se enhyehyɛ aba se betimi include Ghana Psychology Association omotimi ahwe no nso so betimi I council ma bra wo mo ko chiro wo mo exams medase.
Right. My name is Evelyn Tengma from TV3. My question goes to the FDA, Madam. I want to find out what is the conclusion of your results. Can one say that, listening to you, can one say that all the kids didn't pass the test? And what is the advice that you have given to the owners or the people who brought the test kits to you? Thank you.
Thank you.
My name is John Aouni. I represent Kesben. I just want some clarity from the Director General. When the government of Ghana decided to come to the aid of Ghanaians who were stranded outside, these evacuees were brought in, their tests were taken, 14 days quarantine was effected, and then after which some of them went back to or joined their families right here in Ghana. But the issue was that some didn't get their test. Their test results were out, and then they went to their families. Some few have been chasing for their results. As I speak, they've not gotten it, but they are with their families. What accounts for that unnecessary delay? Thank you.
Thank you. Could you, your final for this batch, and then I'll take a final batch of 4.
My question goes to Director General of the Ghana Health Service. Doc, please, how effective is hydroxychloroquine, zinc, and then Zithromax in treatment of COVID-19? We've seen elsewhere that some doctors are claiming that it's very, very effective for, treatment of COVID-19. Are we going to use it, or have we started using it? And then to FDA, how far with consultation and then deliberations on any herbal medicine for treatment of COVID-19?
Washing our hands
so
and
people
our
are saying
fruit
that
is a good
aren't we
idea.
going to aggravate the situation
Hello
further?
and welcome to In
And
Good
Dr.
Shape.
Aboagye,
What do you actually
now that
like to eat?
the sanctions are
Wouldn't you
being
agree
eased
that it depends
because
a
of
bit on the
some
way?
advice to the
We
president,
Germans love potatoes. Kind of funny
aren't you
considering they
anticipating
originally
some
come from South
spike
America.
or
For half
hike
of
in
the
the
world, rice
infections?
is the number
And when
one
it happens,
ingredient in the kitchen.
are you ready
The Japanese
to
word
combat
gohan
the
means not only
infections?
rice,
Thank you very much.
also
Thank you.
food.
I will comment on
Let's
only
look at
one
another
matter, and then, Doc, I'll leave the rest to you. It's
It is
about
native
the
to
female
Mexico,
national
but
teams.
today it's eaten all over the world.
So you would observe that
Cereals
sporting
play an
activities generally were banned, and then during the first phase of the easing of restrictions, individual non-contact sports were exempted. Now, a request has been made by the sporting authorities upon consultation with the Ghana Health Service that for these two teams, they can put in place a mechanism to ensure that their safety is assured while they prepare for this, for these tournaments. And so what the president announced is the policy approval that these teams, the Ghana Health Service, the Ghana Football Association, and then their management teams will work on the details of that and execute that. At this high level, we'll not be outlining all of those details. I'm sure the Ghana Health Service and the Ghana Football Association, etc., are able to then provide you the details of what they will be doing to give life to those assurances that they have given, that they can manage this very small number at their own level. That's what I would say to that. I'll leave the rest to Dr. Aboagye to respond.
Thank you very much, Honorable Minister. I will start with the Kasapa FM. I think that was in Chi. Okay, so I'll do both. For the transport, I think I'll explain how you can contract the disease. It can be from contact through fomites, and then you put on your face or whatever, and in your orifices that you're able to get. There are also droplets. That also comes from the person who is positive. And these are from your breathing, your speaking, your singing, etc. And so the risk of infection is first by close contact and also by very close, and then the respiratory activity. So if you look at other places, when you are talking, when you are singing, when you are shouting, you are expressing more viruses, and so the risk of contamination is good. What we also know about transportation is that besides the social distancing, the cleaning of surfaces, etc., is routine. The wearing of masks is routine. But we also know that activity in a car is not like in other places. And based on our own experience in all our contact tracing we've been doing, we've had several instances where we have picked a positive case who was in a vehicle. Bono is to Wa, in so many of these places, and we have not been able to identify anybody who became positive because he was in the car with these people. Someone had traveled all the way from Accra to Wa, and several instances. So the evidence we have here doesn't show that the risk of transfer in a car is there. So that's why with the wearing of masks and the cleaning of surfaces regularly, the risk of transfer or contamination in a vehicle is reduced. And that's what informed the decision to allow for that to take place. But of course, we'll continue observing. Psychology Association, I think as part of our response from day one, we've always been with the psychologists. From the time we quarantined the returnees, results were delivered by psychologists. They spoke to all of them. They are part of our team. The schools have their counseling, and they have a teacher who is responsible for counseling. So I think the schools are even already equipped with providing such support for people. But I believe that in the school where there's a need for anybody who needs further psychological counseling, we have good collaboration. We have a team of psychologists who are at our treatment centers, who are at our isolation centers, who are available to provide support. So once the need comes, they'll be talked to. The delay in testing the quarantine, I think that happened in the group where we had significant challenge with reagents because of the global shortage. But when you are quarantining people, there are two things. You test and isolate and treat. If you quarantine them for 2 weeks and they also don't develop any signs and symptoms, then the risk that they are going home with infection is technically non-existent. Even if they were positive on arrival, they would have recovered by then. So by the strict adherence of quarantine situation where you are not mixing and being there, that's why we allow them to go, because the risk is low. But obviously, the results currently are being sent to those as they come. If I show you what I showed today, you could see that we're still having, unlike before, a few tests that are coming from the backlog. But these are reports that are being processed. But in terms of processing and time, as I said last week, from the 6th of July backwards, all tests have been sorted out. We are just pulling out the results and sharing with everybody. The zinc, hydroxychloroquine, and Zithromax, I'm sure FDA can have a word about it as well. We as a country are giving hydroxychloroquine, and we are also monitoring outcomes. Very soon our results will come out, and we'll see whether, compared to those who are on Zithromax and those who are Zithromax and azithromycin and those who are on just hydroxychloroquine alone, what is the outcome? I think that would be very, very helpful. What we also know is that zinc helps protect what we call the mucosal lining. And this is where, if it is weak, it's easy for a virus to enter. So it has some protection of the linings in the mouth, the nose, etc. That does not allow easy entry of the virus. So that's why we use that and add vitamin C to our treatment. The Zithromax is to also prevent secondary infection because it's an antibacterial. So if you have that, you may have some bacterial infection that will worsen your case, and so it also provides some protection. But for the hydroxychloroquine, as soon as the results are out, we share and see whether does it work for us, what is the difference, does it give us additional protection, and then the decision will be taken. But currently, we're using it and we are collecting data on that. I'm talking about the backlog. Yeah, the backlog has been, some have been done. I mean, after the 6th of July, we've cleared everything after the 6th of July. Like we're saying that we still are prioritizing our tests. We do not want to be locked up in the backlog. We want to be able to see, take care of the people. If you saw what the graph I showed you, saw that a significant number of the tests that were reported were more recent ones. And so we are prioritizing those recent ones whilst we go back to look at the old ones as them. Because, I mean, if your sample was taken 6 weeks ago and you are still alive, definitely you don't have COVID anymore. If you had one, you had one. But those who were sick, we'll go back and see what was it. I mentioned earlier that if you have a reason to take your sample because we suspect COVID, we will treat you as COVID until your results come. And in 2 weeks, we'll discharge you. Easing and anticipation. I believe that once you are easing, as more people are going out, obviously the risk will, in theory, increase. But what we have also noticed is that people are increasingly adapting the protocols. And so that we expect, that was the reason for that because people are increasingly adapting the protocols and the positives are coming down, that will counter any sense that there will be risk in spike. But if you have also agreed that we need to live with the virus, we must also do the balance as we ease. We also increase our use of protocols, our protection, to be able to balance off that. And so that is why we are also intensifying our education, and we are hoping that the media will assist us, and everybody, opinion leaders, chiefs, everyone, will encourage to ensure that as long as we are doing the triad of hand washing, wearing of your mask, and social distancing, your risk of contracting the virus, it will be low. We have had people who have been around almost all people who have had positive, but they have not turned positive. And one thing I've noticed about them is that those with adherence to protocol is not. Some of them, even when they are drinking tea, they just put a mask, sip, and put the mask back on. So one sip at a time. So it's adherence to the protocol is what we need. Otherwise, we cannot be locked inside forever. Thank you very much.
Thank you, Doc. And colleagues, we will draw down the curtain on our briefing.
That's a question.
Shortly. Ms. Datsun, there's a question on whether you conclude that the kids have not passed the tests yet, and if you want to make a comment on the kind of medication as Dr. Aboagye invited you to, and then we'll wrap up.
Thank you very much. So far, all the 34 kits that have been submitted, not one of them has passed the test. And you asked what we have, of course, communicated back to the people who submitted. So for everybody who submitted a test, like we always do, we have communicated. There are two parts of every test. There's a sensitivity and there's a specificity. So depending on which part has failed, but you need both parts to pass before that kit has passed. So depending on what it is, we will tell you to improve on that part And the manufacturer understands what to do to improve on the kit and then to resubmit. So that is what we've done to all of them. There was a question about herbal medicines. Currently, the application, the 31 or 33 products were actually given to the Mampon Center for Plant Medicine Research, not to the Food and Drugs Authority. And once they have done their research, the Ministry of Health gave it to them. Once they have done their research and they have found that any of them can be used for treatment for COVID, they will give it back to the minister, and then it will be handed over to the Food and Drugs Authority to do the registration of the products for COVID. And I think what Dr. Aboagye said about the hydroxychloroquine, there's data that is being gathered on the use. And once that is available, the data will be published for everybody to see. Thank you.
Thank you. Colleagues, thank you. We'll see you on Thursday.